Welcome to Side Effects with an A. When effect is normally used, it's a noun. It's already occurred.
Effect is a verb meaning action. Action influences outcomes.
I'm Scott McGohan.
And I'm Anne-Marie Singleton. We will provoke you to think differently.
Side Effects, where problems are defined, solutions exposed. Welcome to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton.
Hello.
Hi. We have a guest with us today, Susan Becker.
Hi.
Providence Medical Group. Is that right?
It is, yes.
Okay.
Nice
Thanks
to be
for
here.
being here.
Well, thanks for being here. One of the things that we're really passionate about, and we've been talking to our own customers about, is the impact of a primary care physician and the importance of that. And Susan and I, as we were walking in the building today, we were talking about going back to the future. So I'm 52. I can remember the days where you had to select a primary care physician, an HMO,
Gatekeeper.
this gatekeeper strategy, which we thought was this silver bullet, and it went away.
Right.
And it went away. And now we're talking about it again. So we're talking about this whole evolution. So a little bit about you and your background. So, like, where'd you come from? And we know where you are now. So let's just talk a little bit about
Well,
that.
I've been in healthcare for over 30 years, so I'm a little older than you,
I know.
just slightly.
We didn't tell you you had to announce your
Yes.
age on this podcast.
But I started at Grandview Hospital in 1986 in the administrative offices, working with physicians, and I've worked with physicians my whole career, mostly the primary care side, but specialty too, and worked in the hospital systems here locally. And in 2002, started this company, Providence Medical Group, with physicians who were the owners of the company, with the goal of having an independent, physician-owned group that is really more unbiased when it comes to directing patients for their health care, which has worked out very well for us because with consumerism coming back into healthcare, people paying more for their own health care, want to make more choices. And for us, we can be flexible and get patients where they want to go. So that's a market advantage for us.
Yeah, so going back in time, one of the things that was really interesting in our conversation is, so you were with a health system
Yes.
that owned primary care physicians. They divested, and those physicians said, hey, we need a place to go.
Yes.
You show up and say, hey, let's put this group back together.
Yes. Actually, I was with them.
Gotcha.
So I was the director of operations for one of the local hospital systems. And they asked me to come with them when they left and set up this company. So that's what we did. We started with basically nothing and built a company from the ground up that is thriving today in a market that is highly competitive.
Yeah, and so most of the primary care physicians in this market today are owned by or employed by the hospital systems.
Yes.
Again, right? And so in your, I don't know if you've got any numbers around that, in your estimation, what percentage of primary care physicians are hospital owned or employed versus independent?
Well, I don't have the exact numbers, but most of the specialty care is employed in the marketplace, and that specialists constitute more of the market than primary care.
Right.
But I would say probably at least half, I think, of the physicians in primary care are employed.
So nationally, it's like 38% of the physicians are system owned nationally. Cincinnati is, that percentage is
Very
much
high.
bigger
Right.
than Dayton. Why do you think that is?
I think the employers have had an impact on the market consolidation down there. There's more competition down there, so hospitals tend to compete purchasing physician practices.
Yeah, great point.
So
you got
people go
5
from-
systems down there.
We have 5
We've
systems.
got 2.
We have 2 systems
Right.
here. We basically have 2 commercial carriers here.
Yeah, you're preaching to the choir on
Yeah.
that. It's something we've been
It's a
talking
problem.
about for a long time, and it is a problem. But one of the things that I think became very evident to us a number of years ago is that who's in the best position to direct care for an individual. And employers have tried to do that through their health and wellness programs, and not that we don't think they should continue to do that, but not supplementing it with something external. I think they haven't gotten the full impact of that. Brokers, I mean, we have access to the employees during employee meetings, during education, throughout the course of the year. We can in some ways influence their decisions through the plan designs that we recommend. But again, we're not clinicians, we're not there. And so who best to direct care for a member than a primary care physician? And I think on top of that, the independent primary care physician So can you talk a little bit about why you think that model is the best?
Well, I think, I'm a believer that there's something for everybody in a market. If the market has proper competition and choice, when you have competition, you have choice, you have lower cost.
Right.
So the employed models work for some people, and the independent model works for others. And our goal is to make sure that we can continue our independent model here in the community. I think the independent model allows consumers to make a choice, more choice, as I said before. And one of the things that's important to us is creating a partnership with patients.
Right.
Right now, primary care, being at the center of kind of a navigator type of a position, is important for consumers, because we can read on the internet a lot of things about healthcare. We can go to the urgent care clinics, but that, as you said, fractures care a little bit.
Well, and I think some of it too is, in our role, sometimes we'll talk about, what's a great wellness strategy. So it might be a Fitbit, it might be an HRA, it might be another wellness corporation that we would bring inside of a company. And as much as we care and as much as we try, I think in retrospect, looking back, we just confused people.
Right. I mean, I think that, from where I sit, and you can agree or disagree or jump in, is you have to know your health status, and then you have to either maintain your good health status or incrementally improve the health status that can get better. And that's the whole goal of any health and wellness program. I think it's the goal of most people as individuals.
Yes.
But being able to do that, it's not as easy as saying it, right? Because people have jobs and lives and things come at them. And so having a wellness program at work where you've got more opportunity, it still doesn't connect you. Most wellness programs today at work site places don't connect you with someone who can lead your clinical programs or your primary care discussion.
Right. Well, the consumers pay for the health care, the employers pay for the health care,
Yep.
And that is a little offset from the actual providers of the health care, which, the physicians and the hospital systems and everybody else. And I think the big issue about it is that consumers need to be part of it, but as consumers, we haven't really focused on taking care of ourselves and keeping ourselves well.
Right.
We focus on going to get care when it's too late
Or when we're sick.
And so
Right.
for providers, they're used to treating sick people, and now we've moved into this arena where we're trying to help people stay well.
Yeah,
and
which
that's
is really
a completely
interesting.
different conversation.
Yes.
It is different because one of the things that's really interesting, nationally, they say that a primary care physician can be responsible for about $1.7 million of revenue to a health system. So the health system is the mouth of the river. Does that make sense?
Yes.
We've got all these streams
Yes.
coming down. And then, so one of the things that we've learned with the organization, you're super passionate about, when we talk about pay per value, right? And the impact that you can make on the patient and their health. So how did that evolve?
Well, we've actually been participating in transformation projects through the government for the last 5 to 6 years.
Is that through the Innovation or Payment Council?
Yes, it's through the Medicare Innovation Center in Washington, and it was a pilot program called the Comprehensive Primary Care Initiative, which the focus of that over the last 5 years was to transform care delivery by funding care coordination in offices, providing resources for primary care physicians to have more of a team concept in taking care of patients. So for our group, we used a lot of those fundings to support care navigators in our offices, nurses who pay attention to patients when they get out of the ER, help them avoid going to the ER unnecessarily, which is a high cost expense, readmissions, focusing on getting people into the hospital, from the hospital into the practice within 2 or 3 days after they get discharged.
Right.
So their likelihood of them returning back to the hospital is reduced, significantly reduced.
Which sounds really different than maybe this model of fee for service. So I go in.
Yes, it is.
There's a transaction. The employer pays a part of it. The employee pays a part of it, and we're finished.
Right.
And so you're not.
No, and you mentioned earlier about capitation, or how we had patients years ago when we were younger, where the
still
primary
young.
care doctor was
Still
at the
young.
center. And
Yeah.
I think the difference over the last 20 years is that there's been an attention to quality, understanding what resources really need to be used to take care of patients, involving patients more, and being able to be a partner with patients more than something that's kind of a paternalistic type of an approach.
What's really interesting in this conversation is one of the things that I love is if you're super intentional about this, which you are, then isn't this really a race to quality and talking about quality? So you mentioned you were at a large employer.
Yes.
And
We are this week.
Yeah, you're right. So you're there. You've got feet on the ground. You're working that right now, and you're talking about HRAs and getting those folks involved and engaged, attributed to a primary care physician. You care about the metrics of your patients, right?
Yes.
Under pay-per value, and Ohio's done an amazing job in
Yes,
that
it has.
across the United
Ohio's
States.
definitely a leading state.
And then so if I think about this from like 60,000 feet, I've got these practices that are on this race to communicate quality of the healthcare dollar.
Right.
Yes.
And make sure that the outcomes are there. I mean, when would we have heard 5 or 10 or 15 years ago that a primary care practice was engaged with a large employer in a community?
Exactly.
I mean, that just wasn't a thing that happened, right?
Right. Right. We kind of stayed in our own world.
Right.
And
Waited for the patients to call and come in.
Yes, and
Right.
there's still a little bit of that.
Sure.
But more accessibility. This team approach. We employ physicians, we employ nurse practitioners and physician assistants. We have a whole team around patients, and I think that's the biggest difference. Is it's not just the physician and the patient. It's the whole team that's engaged in helping the patient navigate their health care.
Yeah, and you said something interesting just a moment ago. You said we're really in partnership with the patient versus being paternalistic. And we hear that word paternalistic still often with our employer groups, privately owned companies, family-run companies that are third and fourth generation, and they want to be paternalistic because that sounds like something that works well, right? But in this case, being in partnership is where you're getting the results versus being sort of in charge and telling them what to do.
Right. I think, let's see, in 2011, 2012, we became patient-centered medical home certified practices. And I think that we were the first entire group to become patient-centered medical home. And the concepts behind that are putting the patient at the center and being a partner with the patient. And so we've been on that trajectory for the last several years, trying to engage people in the way that they want to be engaged, not the way that we want to engage them. That's a big difference.
Right.
So, looking into ways that we can be more available to patients, do telemedicine, responding through our patient portal, using technology to reach patients in a different way and care for patients in the way that they need to be cared for. Everybody's busy, and you can't have everybody come to the doctor just between 9 and 4.
Right.
And so being able to, that's part of making a partnership with people.
Yeah,
That's so
we're talking
exciting, though.
Yeah,
It's
it
for
is.
me,
It's
it is.
completely different. Well, you didn't grow up in the HMO world.
Well, I'm 4 years younger than you, so I'll let the listeners do the
There you
math
go.
on that. So
Yeah.
not that
but
much.
you were in a different industry back then.
So,
Yeah.
well,
Yeah.
okay.
'Cause
But
we
I'm
are-
in the penalty box apparently now.
Yeah, we are back to the future.
Okay.
We're talking about capitation, we're talking
Yes.
about gatekeeper, but what's really important is we're talking to employers about this all the time is the relationship with the primary care physician and getting attributed to that physician can result in savings to the employer and the employee.
Right.
Of right now it's about $18 per member per month, which is a lot of money.
Based on the data out there, that's what we see.
Correct. And not only is it just dollar savings, but what you're telling us is the quality of life is increased as well. So the patient, you're really intentional about understanding that person. Because a lot of the wellness technology, and I'm a big fan of technology, and this might tell me metrics, but I don't have a relationship with this. Does
Right.
that make sense?
Right, you can't ask it questions, or maybe you can type
I can ask
questions in.
Siri.
Yes.
Right.
Yeah.
Yeah, so Siri can deliver healthcare.
Yeah,
Yeah.
that's a really bad idea, isn't it?
Yes,
Yeah.
Siri yells at me most of the
Exactly.
time, so I don't want
Exactly.
that.
Yeah.
So you heard it here first. Siri can deliver healthcare. No, I'm just
Yeah.
kidding. But no, the idea that you would be trying to keep people well is just a different. And you think of doctors and cures and all of the wonderful advances that have taken place in medicine over the years, and really even just the things that we've seen in the last 10 years. But the concept of let's keep these patients well in the practice of medicine is fairly new.
It is, and it hasn't been paid for very long by the insurance companies.
Right.
Now that the ACA changed all of that, so I think that opened opportunities to have different conversations with patients.
Yeah, and you had to take advantage of that, right?
Yes.
And you had to care about doing that.
Yes.
Right.
Because other entities aren't doing that. So I think what I hear in you and your passion and your folks is, one, you just care a lot, but you also see way out and the value of this long term.
Yeah.
So you serve 56,000 people in our community.
Yes.
That's a lot of people.
It is
That's
a
a
lot
lot
of
of people.
Yeah.
And so, and I'm amazed at the staff you serve them with. So can you talk a little bit about your model with the nurse practitioners and the physicians and how you've used that?
Well, I think that just creates more availability. Everybody talks about physician shortage. There aren't as many people going through medical school or into primary care because the payment structures were low for many years, and so that created a gap. And here in Dayton, we have trouble recruiting physicians.
Yeah.
So when we began our company, we had nurse practitioners who were coming into vogue at that time, and we started hiring them and hiring the right people to create a team concept. So they work side by side with the physicians, they're nurses, so they're trained differently than physicians, and they make a really good team. Physician assistants are the same type of situation, and those as kind of the core providers, and then staffing around that with care navigators who are nurses, medical assistants, the business side, where we can help people navigate the cost,
Right.
and the claims process, which is complicated for people. People avoid healthcare because they're afraid of the cost structures of
And it's
healthcare.
complicated.
And they
They don't want to appear like they don't know. They don't know
Right.
what questions to ask.
Yes.
And I mean, this is going to sound weird, and people who know me know I'm a little nerdy, but like, I want to go to the doctor listening to you talk about that experience, So if you can get Scott to go, I mean, you're doing a great job.
Our goal is to have
Yeah.
everybody should go once a year.
Yeah.
Get a check-in with your physician. Even a 27-year-old guy has something that can be discussed about their health care.
Oh, to be 27 again.
Yes.
Yes.
This is true.
So one of the things that, number one, thanks for being here today.
Sure.
Thanks
having
for
me.
caring about our community. So if I'm an employer and I'm listening to this, who would I call?
They wanted to know more.
If I
They
wanted
can
to know
call
more?
me. They can
Okay.
call me at Providence Medical Group. And our number, do you want me to give our number?
You
Sure.
can?
Okay, it's 297-8999.
Perfect.
And we'll put a link out there on healthierbirthdays.com so you can go to their website, look at their structure, see what they're all about. And we really appreciate you being with us today.
Thank you for having me.
Yeah, thanks for putting a dent and making a difference.
We're going to keep trying.
Excellent. Join us next time on Side Effects. Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
On Side Effects.